Your healthcare provider has determined that you have or potentially have allergies. Being concerned is normal, and you probably have questions. We have the answers. This short presentation will tell you what allergies are, how they are diagnosed, what tests will help to confirm what is causing your allergies, and what treatment options will be recommended by your provider to improve your health and quality of life. If you have questions after watching this short video, your provider will be able to help. First, what exactly are allergies? An allergy is an undesirable response to a foreign body that can affect your lungs, nose, skin, eyes, cardiovascular system, or stomach. In other words, your immune system is saying no to certain allergens, which are substances that cause an allergic reaction. Allergens can include pollen, animal dander, dust, molds, or common foods, anything that your immune system does not respond well to. The symptoms can be uncomfortable as well: itchy, watery eyes, sneezing, and other issues. But you're not alone. Allergies are the 5th leading chronic disease in the United States and affect approximately 1 in 5 Americans. Along with asthma, that's more than 60 million people. And there are many reasons that we're seeing an increase in allergies, from pollution to higher pollen levels, increased exposure to food additives, genetics, or even a weaker immune system. The first clue to finding out what is causing your symptoms is your provider's physical examination and your personal health history. Be sure to let them know what time of the year you are experiencing symptoms, what time of day, are they worse indoors or outdoors, and if you notice any trends or things that appear to trigger your symptoms. Also tell your provider if any medications you are taking appear to help. All of this information will help your provider to determine the best course of treatment. Before determining treatment, your provider will want to run some tests to confirm which allergens are causing your allergies. This will either be done through a blood test or a pain-free skin test. Skin testing is safe for virtually all patients of all ages, even very young children. A small amount of allergen is introduced onto the surface of the skin, and you only need to wait about 15 minutes for the results. There might be some itching or mild discomfort during the test, which is easily tolerated by most people. Your provider will determine which testing method is best suited to you. Testing will both rule out and identify what is behind your symptoms. A positive result means your immune system is responding excessively to the allergen, which is why you feel ill. By identifying the triggers, you may be able to avoid them, and your provider can determine the best path of treatment. There are 3 primary treatment options. The first is simply avoiding the allergens, but depending on the allergen in your lifestyle, that can be difficult. The second is to continue or start with allergy medications, which will lessen your feeling of discomfort. The third option, if appropriate, is to slowly expose you to small doses of the allergen that you're hypersensitive to, increasing the amount over time. This option works to build your body's immune system to these allergens, thereby overcoming your excessive reaction that causes your allergy symptoms. This is called allergen immunotherapy, and there are 2 methods. Sublingual immunotherapy, which involves taking drops twice daily under your tongue, or subcutaneous immunotherapy, which are shots you need to take weekly, bi-weekly, or monthly at your provider's office. Many patients on allergen immunotherapy report significant symptom relief and far less need for allergy medications as early as a few months into their treatment. Your provider will discuss which is the best method for you and your condition. So what else can you do to prevent allergies? It's no surprise that positive lifestyle changes such as regular physical activity, eating a healthy diet, and being a non-smoker can help. So let's review. Allergies affect millions and the numbers are growing. Your provider will determine whether a blood test or skin test is more appropriate. After your test, your provider will determine the best course of treatment, and it's possible they may refer you to an allergy specialist. Thanks for watching. We hope we've answered some of your questions. Your healthcare provider will be with you shortly to continue the conversation about this important topic.